and good afternoon. Today is Friday and it is time for our regular lunch and learn. And so I'm excited to share this with you because there is a lot of coughing going on, just a whole lot of coughing. And so when I read this report, I thought that it was, number one, very, very timely. And number two, I thought it would be some information that would be good for you to know. I've read a couple reports this week that say cough medicines do not work. And if you have had a chronic cough, you will probably already know this. There's nothing any worse than having this chest thing that's going on and you can't get any relief for it. So today we're going to talk about that. We're going to talk about some natural remedies that you can do. And we're also going to talk about why you may be having this cough. So one doctor describes a cough as a burglar alarm. So you know that your lungs and your upper respiratory tract are fighting an infection. Now, it can be a bacteria or it can be a viral infection. And so we're going to talk about the differences of those and how you look at each one of those. And so we're going to do that. We also want to know, how dangerous is it to have a chronic cough? Hopefully you don't do that. Most of the time, for me, I'll be walking probably outside and pollen will get me or some kind of allergen will get me, although I don't have a whole lot of allergies. And I'll take a deep breath and, I have to cough a little bit because something got in there that my body didn't like. And so that's what this is Dr. Kane Fan Chung. He is the director of the National Heart and Lung Institute at the Imperial College of London. And that's what he says. It's like a burglar alarm. And so we don't want to quieten that because if something's going on, we definitely want to know about it. However, it can be very, very annoying. So there are a lot of cough receptors in your lungs, in your vocal cords, in your upper airways, also in your ears, in your eyes, in your nose. You've got all these cough receptors in there, and so you can be coughing for a variety of reasons. So one of the things I wanted to talk to you about, because you probably didn't know, and I didn't know, but when you cough, you're expelling air at the force of 50 miles an hour, all right? And so this is why you really want people to cover their mouth when they cough, because it just comes out with such a force and it's just projectile, and we can all get sick when that's happened. So talks about the actual physical function of a cough. It says when we cough, we often gasp deeply, allowing the air to penetrate the lungs. Following this, the glottis closes, covering the airway, while the muscles in the chest and abdomen contract forcefully. At this point, the air is trapped in the airways and cannot escape, resulting in a significant interthorax pressure, typically exceeding 300 millimeters of mercury. Now, millimeters of mercury is what you test when you're testing your blood pressure, same kind of thing that you're looking at there. But when you cough, the glottis opens up and all of that trapped air rushes out at speeds up to 50 miles an hour. I thought that was crazy. And the reason that does that is because it expels the mucus and it expels whatever's irritating you out of your airways. So you can have, as we said, irritation with pollen, allergies, chemical toxins, inflammation, mucus in the nose, and stomach acid can all affect your coughing response or coughing reflex. Any kind of sensory receptors that are located in your ears, your nose, and your stomach, your pleura, your lung area, your pericardium, and other areas are all capable of triggering a coughing reflex. So it might not be anything that's an allergy or anything that we would normally think would cause that, but we have some kind of an issue. I know one year, it has probably been like 22 years ago, I was in a classroom and happened to walk by a student he had just opened a bag of hot Cheetos, right? I don't like hot Cheetos. I don't like hot anything. Anyway, he had just opened this bag of hot Cheetos. I must have been taking a deep breath as I walked by because the fragrance of that snack attacked me. And my vagal nerve, which your vagal nerve is your largest cranial nerve, it attacked me and I started coughing. My heart rate went from whatever is normal up to like a bazillion beats per minute. And I think I'm going to have a heart attack. And so I'm sitting on the desk and I've got my hand on my heart trying to figure out what was going on. And after a few minutes, it seemed like hours, but after a few minutes, everything kind of calmed down. And I asked one of my nurses friends, okay, what was that? She said, well, something in those spices hit your vagal nerve, which started a coughing response. And, it can happen for any number of reasons. So coughs are classified into 3 types. Those lasting less than 3 weeks are called acute coughs. Those lasting from 3 to 8 weeks are called subacute coughs. And then a chronic cough is something that lasts for more than 8 weeks. So we know, and you may have heard this, you can tell by people's voices if they are smokers, because if they're smokers, then their voice is deeper because of all the irritation. They often will have a cough. They often will have COPD, which often has a cough. So those would be chronic offenders, for lack of a better word, okay? So the acute cough is very, very common, says Dr. Paul Merrick. Now, he was the chairman and chief scientific officer of, and I'm going to have to speak in code because, we get censored all the time. He is the chief scientific officer of the frontline upper respiratory disease, okay? So he's a former chief of the Division of Pulmonary and Critical Care Medicine at Eastern Virginia Medical School. He says acute coughs happen after an upper respiratory tract viral infection, including the common cold, the flu, or any other type of respiratory virus. The inflammation in the respiratory tract sets off those sensors that triggers the coughing. Most patients who have an acute cough, it's the body's response to the infectious agent. He wants you to take notice of what you are coughing up. So we will always ask, if you come in and you're telling me you have mucus, you've got congestion and that kind of thing, we will often ask you, okay, so what are you coughing up? What color is it? Is it thick? Is it runny? And so it can be clear, it can be cloudy, it can be white, it can be straw yellow, it can be deep yellow, and it can even be green. Right? If you're in the green category, you definitely have some kind of infection going on. So please don't wait until you get into the green category to have any kind of help there, because we really want you to get help before it gets to that kind of a situation. Now, he says most patients with an acute cough will resolve itself. There's nothing really that you can do. Now, subacute coughs, those are the ones that last for longer than 4 weeks, are caused by upper respiratory viral infections. Now, you may know, you may not know, you cannot go to the doctor and get antibiotics that will do any good on a viral load. So this is why some people go to the doctor, they say, I've got this, that, and the other, and the doctor says, well, it's a virus, we're not going to give you antibiotics. And so people get kind of frustrated because they don't feel like they're being taken care of. Antibiotics are antibacteria. So if you have a viral situation, you've got a different kind of critter that you're dealing with, and antibiotics have no load for that. Now, in the holistic land, we do have natural antibiotics, antivirals that we do want you to use, and it will take care of a respiratory tract infection, whether it is viral in nature or whether it is bacterial in nature, okay? And even subacute coughs will naturally resolve on its own. However, Dr. Merrick highlights that observing the characteristics of the secretions is crucial. Like I said, if we have the green cough, we really need to go and get some medical attention, because your body could have a hard time overcoming whatever's causing that infection. So let me just take a little bit of time here and talk about the body and how the body works, especially if you're wanting to control your health or work with your health in a holistic way. So most of the time, and I've been guilty of this too, so this is not something out of the ordinary. This is just something that we don't know any better, and so we do this, right? So most of the time we wake up, we don't feel good, but we don't feel bad enough to go to the doctor, so we'll just kind of, push through the day. The next day we wake up, we're feeling a little bit worse, but not really bad enough to go to the doctor. And so the third day we wake up, we're really feeling pretty bad, but we can't get to the doctor for a couple of days because they're booked up. So that's kind of how that goes. So what's happening is whatever has invaded your space, and I use that in the nicest possible way, your body is starting to tell you on day one, hey, there's something wrong with me. But because it's not that bad, Most of the time we don't do anything. Well, for me, when I wake up and I don't feel quite right, which is rarely, it is rare, but when it does happen, I immediately go to my medicine cabinet and I pull out my natural antiviral antibiotic. I've got a liquid formula that I use, and I've got a little tablet, not tablet, but a gel cap that I use. And I will set my phone for every 2 hours. And every 2 hours, I will take a dose of each. And by the end of the day, I'm good. Now, why is that? That's because I have understood that my body's trying to tell me, hey, you've got an invader here. I take really proactive action. So we're not waiting 2, 3, 4 days for that bacteria or that virus to multiply and overtake my immune system. So this is why in holistic world, we hit it hard, hit it fast as soon as we don't feel well. Now, you're not going to have any overdose issue with any kind of natural supplement. What you are going to do is give your immune system what it needs in order to fight whatever's coming against you. Now, I've told you this before, but maybe you weren't listening. Back in 2019, 2020, when everything just went crazy, we started taking the antiviral, antibacterial supplement. And because I was not sick, I was not in a crisis, I just took one in the morning, one in the evening. And I did that for probably 2 or 3 years. Never got sick. And I was closer than you and I are right now with people with full-blown disease, okay? So you can have your immune system be on such high alert that when that bacteria comes in or when that virus particle comes in, your body just goes and does what it's supposed to do so that you never get sick again. And so that's one of the reasons why I like doing Lunch and Learns, because I like showing you and telling you what my experience has been and how you can have that same experience as long as you have things on hand that you can take immediate action. You don't want to pussyfoot around with it, right? I don't want to wait a day, because by that time, whatever infectious agent has multiplied and multiplied and multiplied, and it's going to take my little white blood cells just much more effort, much more time, and it's going to be very hard for them to overcome. Whereas if I hit it hard, hit it fast on day one, by the end of the day, I'm golden. No problem, nothing whatsoever. So pertussis, all right, is a disease that is causing acute coughing. It is a specific type of bacteria that gets in the lungs, and even adults who receive multiple doses of the pertussis vaccine can fall ill with the disease. The coughing in pertussis patients is distinctive, resembling a dog mark, which makes it very recognizable, and that's why they call it the whooping cough, all right? So we want to make sure that we don't have this chronic cough or subacute cough, because excessive coughing has the potential to damage the throat and the upper respiratory tract, leading to a vicious cycle of injury. Now, what I call this is a negative feedback loop. And so in holistic world, right, we don't want to have pain at a level of 10 out of 10, because it's very hard, unless you're on a steroid or unless you're on some really strong narcotics, it's really hard to get that 10 to come down. But if you start dealing with pain when it's a 1 or a 2, it breaks that cycle and it usually doesn't escalate. The same thing with coughing. If you take care of it early, you're not going to get in that negative feedback loop of your bronchioles and everything being all irritated. And so they're irritated, so they're going to get relief, and so they're going to start coughing. And so you get in this cycle that's really, really hard to break. And so you don't want to have that. You can have severe damage to your upper respiratory tract. And the doctor, when you have that, and you're going to hurt, you're going to just hurt because you've been coughing so much, the doctor is going to give you some corticosteroids for the inflammation. That is going to help with the coughing, but it's not going to help with whatever infectious agent that you have. So Dr. Chung says that when a virus disappears, normally the cough disappears. However, in the past 3 or 4 years, we have found that the cough persists for a long time. In his experience, 60 to 70% of people who have been infected in the last 3 years have a cough for a very, very long time. Nobody really knows what that why that is. They just know that it is part of what's going on. So we don't want that. If that's you, come and see me because we've got different things that we can help you with that. The British Journal on General Practice published a systematic review and meta-analysis in 2018 that included 724 cases of patients with subacute cough following a viral infection across 6 randomized clinical trials. The findings concluded that no treatment regimen demonstrated clear benefit regarding cough recovery or other patient outcomes across all studies. This meta-analysis assessed cough outcomes at 14 days and 28 days. So what does that mean? That means in a medical clinical trial using all their medicines that they had, they saw no improvement in a cough at 14 to 28 days. Now, Dr. Merrick says that the importance of vitamin D supplementation is very, very good because vitamin D helps your immune system to stay strong. And we know in the last 3 years, excuse me, that the people that don't have a very high vitamin D level were more apt to become ill. And so we want to make sure that your vitamin D level is adequate. On your medical reference range, on your blood work, they're going to say that if you have 30 or higher, nanograms per deciliter, I think is how they call that, then you're going to be adequate. But in holistic world, we know that you have to have 70 to 100 in order to be adequately protected with vitamin D. So vitamin D is really, really good for viral infections. It's really good at protecting you from that and helping you from recovery. We also know that zinc is very good. Zinc will stop viral replication. And so if you, as I said earlier, hit it hard, hit it fast, then if you have enough zinc, and most people are zinc deficient, zinc stops viral replication, and so that's very, very important. He also shared that some of the medications for coughing would be inhalants that have menthol in it. Now, that does seem to help because the menthol seems to calm down the cough. Now, you can do this with essential oils, all right? You can take a bowl of hot water, put a couple of drops of essential oil. I don't care what brand you have as long as it is not a synthetic brand. And so what you get at the drugstore, what you're getting at, the big box stores, I promise you is a synthetic brand. You want to get something that is holistic, it is organic. And the way you know that is because on the label, it has 2 words in Latin that tell you what kind of essential oil you have. So you want to use eucalyptus, you want to use peppermint, and there's another one, I'm not seeing it on my paper, but there's another one that you can use. And you put a couple of drops on that in the water, swish it around, put a towel on your head, and make a little tent over the water. And the fumes, the menthol fumes will come in. It will, it'll thin out the mucus. So if you're coughing because you're trying to get something out, it will thin out the mucus, and it will also calm that respiratory tract. And so you're not going to have the cough as hard as it would be. Some of the throat lozenges we know have menthol flavoring and that kind of thing, and that's why they do it. Now, I promise you that is not organic, and so you're going to be better if you have it in organic. Now, another thing that helps is consuming honey. Now, my husband, whenever he gets a sore throat and a cough, he will make himself a little concoction with organic honey and apple cider vinegar with the mother. And what he'll do is he'll probably do equal, 1-to-1 ratio, put it in a glass, stir it, and he will drink that. And that honey will coat, all right? And honey is a natural antibiotic. And the apple cider vinegar, I don't know how it helps, but it does help. That's what he does. And so just a little helpful hint for you. If you want to have honey, then that would be something that would be good to have. So a coughing bout will last 1 to 4 weeks. If it lasts more than 8 weeks, then you need to have some kind of medical intervention because we don't want you to get into that negative feedback loop. So Dr. Albert Rizzio, who is the Chief Medical Officer of the Medical Lung Association and the Clinical Assistant Professor of Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University, says if it lasts longer than 8 weeks, you need medical intervention. The chronic cough is the body's way of trying to get something out of the lung that is not supposed to be there. So they want to find out and make sure that the cough is not caused by lung cancer, chronic lung infections, or pulmonary fibrosis. These conditions are much more dangerous than others. And the doctors will do different examinations, CAT scans, all that kind of stuff to see if you've got that. Now, again, if you are a smoker, if your parents were smokers, if you grew up in smoking, if you're of a certain indeterminate age and it wasn't illegal to smoke inside restaurants and stores and that kind of thing, you may have been affected by secondhand smoke, which has caused some kind of damage in your respiratory tract. And so you want to make sure that you get that checked out, although most coughing is not a chronic cancer, lung cancer situation, all right? Certain proportions of chronic coughs are caused by malignant disease. A review published in 2023 showed about 90% of chronic cough cases are non-malignant. That means not cancer. So 90% of the time, you're good, all right? The remaining attributed to malignancies, including tumors. In a systematic review and a meta-analysis published by the BCM Family Practice in 2021 reveals that the incidence of suspected cancer among patients with a cough range from 0.2% to 1.8%. So the risk of having cancer, a cough being an indicator of cancer, is very, very low. Cancer can induce a peculiar form of inflammation in the tissue, making the nerves more sensitive and thus more prone to coughing. However, the cause of chronic cough is typically not life-threatening. Now, that's good news, but we don't want you to have a chronic cough, because if you have a chronic cough, as I said before, it sets up that negative feedback loop, and then you're going to have damage to your airways and to your tissues. So upper respiratory cough syndrome is a new word or a new label. It used to be called postnasal drip. Now, postnasal drip is when you've got sinuses, and you've got sinuses here, you got sinuses above your eyes. I think you even have some sinuses in your cheek. When your sinuses get clogged up, when there's bacteria or whatever in there, you can have mucus in there. The body's job is to dissolve the mucus, because the mucus coats, dilutes, and takes out of the body things that are in the body. And so when that happens, it can go behind and start draining into the back of your throat, which used to be called postnasal drip. Now, I don't like that. I've had that in my lifetime. I don't like that because it absolutely rips your throat. Your throat, from your mouth to your bottom, your GI tract has mucus in there, and that postnasal drip will actually burn that mucus, and that's why you get a sore throat. Hello, that's what that's all about. And so you don't want to have that, but now they call it the upper airway cough syndrome. That's what they call it now. So the nose serves as a gateway to the respiratory tract, responsible for heating, humidifying, and filtering the air through the appropriate secretions. However, when signals from viruses, allergies, rhinitis, air pollution stimulate the nasal mucosa, it produces more mucus than necessary, with different properties from the usual secretions, and this mucus is thin, watery, and runny. It flows out of the nostrils, down the back of the neck, stimulating the nerves and triggering the cough. So if you've ever had that postnasal drip, if you've ever had that, it absolutely rips the back of your throat, and every time you cough, it is extremely, extremely painful. So we want to help you not get into that, all right? There's also something called cough variant asthma. Now, asthma is when you're wheezing, you have trouble breathing, and that kind of thing. But there's a type of asthma that presents with only coughing, and it is referred to the cough variant asthma. It results in a persistent dry cough and often occurs throughout the day and at night, although some cases only cough at night. It is usually brought on through exposure to allergens, dust, or cold air. Additionally, physical activity can trigger this cough, which that's crazy. Acid reflux also can trigger a cough. So always check that if that's something that you're prone to, if that's something that you're dealing with. Certain hypertensive medicines cause this cough. Lisinopril is one of them that they will give you if you have high blood pressure, and one of the known side effects is chronic coughing. There are a lot of medicines out there for high blood pressure, and so you don't have to have that medication. If that side effect is something you're dealing with, talk to your doctor and get a different medications, all right? So postnasal drip, cough variant asthma, and acid reflux accounts for 2/3 of a chronic cough. So we don't have to worry necessarily about cancer, but digestive issues are one of the things that we see every single day. So if that's something that you have, then you want to come and see us so that we can help you with that, because we don't want you having those kind of situations. Now, there is something called a refractory chronic cough. That is caused by hypersensitivity of the cough reflex. Approximately 30 to 40% of patients with chronic cough belong to that category. Now, I think that what this category is, you've coughed and coughed and coughed and coughed for so long that you're super, super sensitive. And so anything that comes into your field of, your energetic field is going to set that off, and you're going to just cough for no reason. And so we don't want that. So lots and lots and lots of information there about coughing. Hopefully you don't have coughing. If you do, hopefully it is the acute kind that you can get rid of in 1 to 4 weeks. Now, I want to show you what we do here at the clinic, and we have really, really good results. So we've got 2 formulas. Don't ask me what's in them because it's all written in Latin. I know the formulator. I know him well. I trust him. This is what we use in our family. But there is this particular formula. It's called Temple Warrior. Now, I love that because this is your temple, right? And so it has all these Latin words. You're not going to be able to read that because I can't read that. But it's got all those Latin botanicals. And I love the way he makes these. Now, this might not mean anything to you, but it means a lot to me. When he makes these formulas, he makes them in a spiral. Now, why is that important? Because your DNA is in a spiral. And so when you've got that double helix spiral, when he makes these, he makes them in a spigeric formula. Don't even ask me what that means. That's way above my pay grade. But what that means is the DNA accepts it, it goes in, and it does what it needs to do. So if you have a cough, a chronic cough, or even an acute cough, any kind of cough, you want to use this because it's going to soothe those membranes. It's going to bring healing to those membranes, and you're just going to respond really, really well. If you do have the postnasal drip with the coughing, you're going to want to use throat spray. And again, tons and tons of ingredients. You cannot read them. They're very tiny, and they are in Latin. So unless you can read Latin, which I cannot, it goes in and it calms all of those nerves, and it helps you get over your cough very, very quickly. So these are 2 things that are organic, hand processed. Your body's never seen that before. Each crop, we'll say crop, is different because it's all organic. It's handcrafted, it's wildcrafted, all those kind of things. And so whatever bug you're dealing with, whether it's a bacteria or a virus, it's never seen that formula before. Even if you use that formula year after year after year, each batch is going to be different because each batch is different. In holistic world, we believe that God is really good. We believe that he knows what we're facing, and we believe that he causes the plants to have the properties in them that are going to bring us health. Okay, the Bible is full of scriptures that talks about, the leaves of the tree bring healing, and every good green thing is for healing. There's a lot of scriptures for that, and we believe that that's really true. And so when you have suppliers that are very, very committed to wildcrafted, organic, handmade substances, then when you're taking those, that each batch is going to be brand new and different. And if it's brand new and different, whatever you're fighting has never seen it, so it doesn't morph against it. It doesn't have any resistance to it. And so that's the reason that we get such good results with what we use, because we use really, really good products. So that's a lot of information. If you have any questions, let me know. Thank you for liking. Thank you for commenting. Thank you for sharing. And just thank you for being here every Friday for 30 minutes and honoring us with your presence here. We really appreciate it. We hope you find value. It is the weekend. What do we do on the weekend? We take a breath. We recover. We rest. We do self-care, all those kind of things. Why? Because we work hard during the week, right? And so we need to have a day or two. Maybe you're fortunate to have two. I normally can get one, squeeze one out, and have that rest and restoration that we need to keep our immune system functioning the way it needs to. So thank you again for liking and sharing, and I will see you next week.